Hi, a blessed day to all of you. So welcome to your second week in your FNP lecture subject. So this week our topic is about nursing as a profession. So I know that this term, a profession, is very familiar to you because we had discussed it already during your DFN subject and even during our orientation. So, meron tayong brief definition of what is a profession is. And this week, we will discuss it further. Okay? So, my presentation includes the following. No, there are two major topics for today's discussion. The first one is profession, and under this, we will discuss the definition, criteria, personal and professional qualities. And the second topic is about contemporary nursing practice. And under this topic, we will discuss its definition, recipients, and scope. Okay? So, what is profession? So, as I mentioned earlier, you had encountered this term already. To discuss it more further, it is defined as an occupation that extensive education, or it is a calling that requires special knowledge, skills, and preparation. So this means that a profession, it requires a specialized educational training. Okay? It requires a mastery of complex set of knowledge and skills. Okay? So, a profession is an occupation founded upon specialized educational training. So, when we say specialized educational training, so hindi lang yung training na after 6 months, tapos na. So, merong mga steps, may mga level, di ba? May level 1, level 2, level 3, level 4. In each level, may mga competency kayo na dapat pag-aaralan in each level. Like for example, during your first year, second sem, you are already exposed to a basic procedure in nursing, which is yun yung pag-aaralan ninyo in your FNP RLE. So, yung mga basic procedures, matututunan nyo yan. And then later on, may skills pa tayo, i-develop yung skills ninyo sa area. Then later on, you will be exposed into hospital setting, community setting, home care setting, and so on and so forth. So, mag-undergo talaga kayo ng mga training on different areas, on different field. Okay? So, it is, a profession is a paid occupation. Okay, so of course, once you gain your profession, once you finish your 4-year course, mag-undergo kayo ng, you have to take your licensure examination, and once you pass the licensure examination, you are now qualified to work as a nurse in a hospital. But before that, of course, may mga training pa rin kayo bago kayo talagang sumalang. So, may training pa rin kayo. Iti-train pa rin kayo ng hospital. Depende sa hospital kung ilang months ang inyong training. Okay? Tapos, bago kayo ilagay sa isang area kung saan kayo, is it specialized area like OR, ER, and etc. Okay? So, sabi nga nila, it is paid occupation. So, especially one that involves prolonged training and a formal qualification. So, prolonged training. Pag sinabi natin prolonged training, yun na nga, nag-train kayo, 4 years kayo nag-aral, and after that, iti-train pa kayo ng hospital. And kapag mas marami ka pang trainings, more experience, or nag-aral ka pa after ka may board exam ka na, pasado ka na sa board exam, nag-aral ka pa din, nag-master's degree ka, or kumuha ka ng doctoral degree, mas lalong tataas ang iyong compensation. Okay? So, there are two terms related to profession that need to be differentiated. So, we will differentiate these two terms: professionalism and professionalization. Okay? So, professionalism. So, it refers to a professional character, spirit, or methods. So, ibig sabihin, professional character, ito yung nade-develop din yung attitude ninyo on how to handle a specific situation. For example, how to handle a patient na hysterical na yung pasyente or relatives, or how to work with your co-worker, how to work with your doctors or other team member or healthcare team member. Okay, you have to have a spirit. Meron kang spirit na you have the courage to work, you have a positive attitude, and of course methods, may mga strategy ka of how to care for your patient. For nurses, it always mean healing the sick, okay, nurturing the wounded, placing your patients first, and providing, of course, holistic care. When we say holistic care, you have to provide or to give care, not just the physical aspect, but as well as the emotional or the psychological and the spiritual aspect of your patient. And educating new professionals. How is it? You have to educate new professionals as a nurse. Okay, once na pumasok ka na as a nurse, okay, di ba, meron tayong sinasabing novice muna, tas advanced beginner. Okay, so pag bagong pasok ka, novice ka muna. Okay, advanced beginner. Okay, bago ka doon papunta sa mga expert and so on. Okay, so pag nandun ka na, ay may mga bagong entry din. Halimbawa, ikaw naka 1 year experience ka na. So may mga bagong nurses na papasok. So it is also your responsibility to help those new nurses. You have to help them learn how to work in a specific area. So tuturuan nyo rin sila kung paano ang ginagawa, ano ang mga rules, ano ang mga practices ninyo sa inyong area. And especially, how to handle your patient. Okay? So, nursing professionalism owes much to the influence of Florence Nightingale. So, alam naman natin talaga na ang si Florence Nightingale talaga yung may malaking contribution, di ba? Siya talaga yung nag-work para yung nursing ma-identify as professionalism. So, mailagay siya dyan as profession. Okay. And professionalization. So, when we say professionalization, it is a social process by which any trade or occupation transforms itself into a true profession of the highest integrity and competence. So, dapat merong integridad. And, of course, para masabing you are professional. Okay, dapat a professional nurse must be competent enough. Okay, competent ka to work, competent ka to give care or to carry out orders of the doctor. Okay, competent ka to lead. Okay, so yan yung sinasabi natin, professionalization. You have to remember also that professionalism of a nurse actually influence the quality of care that the nurse provide to the client. So, going back to professionalism, okay, in the previous slides, an example of this is that as a nurse, you have to bring positive and realistic attitude to your every shift, So, dapat hindi ka negative, hindi ka puro negative doon sa area mo. You have to be positive to influence the patient as well as your co-worker. And of course, another one, you have to take time to listen to your patient. So, pakinggan ninyo ang pasyente ninyo kung ano yung kanilang saloobin, makapaglabas man lang sila kung ano yung what they want to tell you or how they feel about their illness. Okay? And of course, you have to care about your appearance too as a nurse. So, you don't need to put a lot of makeup, a lot of jewelries. Dapat simple lang. Hindi mo kailangan maging glamorous. Sobra. Okay, you have to help your patient and co-workers. And of course, you have to be accountable of your actions. For example, nagkamali ka, you have to tell the truth, especially doon sa kung sinong mas mataas sa inyo. So, dapat sasabihin nyo kung ano yung truth talaga. And, of course, you have to follow your ethical practices. Ano ba yung, especially when you're making decisions. Okay? So, those are just example of how to act as professional under your professionalism. So, dito sa professionalization, so yung focus natin dito is more on how you influence, diba? Social processes. So, as a nurse, so how you influence doon sa makasama mo with your team member. Okay, and of course nga, dapat with highest integrity and competence. Okay, so these are the criteria of a profession. Okay, so number 1, specialized education. So, na-mention natin kanina, di ba? Profession. Yung profession, so kailangan mag-undergo siya ng specialized education. So, it is an important aspect of professional status. Okay, so ito yung very important talaga tong aspect na to. Kasi, dito ka mag-undergo ng training, dito ka made-develop. Okay? In the United States, today, there are 5 means of entry into registered nursing. So, unlike sa Pilipinas, so parang diretso naman na tayo kaagad ng usually nursing lang yung ino-offer natin. So, meron tayong caregiver, merong midwifery, pero iba yon dito sa nursing. Okay? So, they have hospital diploma, okay, associate degree, baccalaureate degree, master's degree, and doctoral degree. So, this was actually influenced by Florence Nightingale. So, alam naman natin si Nightingale, siya talaga yung nag-work para yung nursing ma-recognize as a profession, not just as a vocation. Although, it is rooted from being a vocation. Okay? So, si Nightingale, siya yung unang nagtayo ng Nightingale Training School of Nurses at St. Thomas Hospital in England in 1860. So, pinag-aralan din natin yan in your TFN. So, pag sinasabi natin diploma programs, actually, parang ito yung mga 3-year program lang siya. Nag-start din to noong 1800s, no, hanggang mid-1960s, pero existing pa rin sa US, no. Pag sinabi naman nating associate degree, ito yung associate degree, nag-start siya or it arose in 1950s. This is the first and the only educational programs for nursing that were systematically developed from planned research and controlled experimentation. So, it's actually a 2-year program based on sa study ni Mildred Montag. Okay? A 2-year program, or ang tawag nila sa nursing dito is nursing technician or bedside, wherein nurse is able to perform nursing function, okay, broader than those of practical nurse. But of course, lesser yung scope niya than those of professional nurse. And we have the baccalaureate degree. So, yan yung kinukuha nyo ngayon dito sa Pilipinas, the BSN. Okay? Yung baccalaureate degree, nag-start siya in University of Minnesota in 1909. Unang start nila noon is actually 5 years siya. Kasi you need to get a 3-year diploma program plus 2 years yung liberal arts education. So, sa kanila, it's 5 years before. But later on, dito sa atin sa Pilipinas, 4 years siya. Okay? So, alam naman natin na kapag baccalaureate degree, you have to pass the board examination. So, the difference naman of baccalaureate degree from the diploma programs and associate degree is, of course, once you are a baccalaureate degree graduate or you are considered a professional nurse, you have more autonomy, but you have more responsibilities, you have more accountabilities, okay? And you have the chance to participate in institutional decision making and of course for career advancement. And the next one is once you have your baccalaureate degree, you can proceed, as I mentioned earlier, diba dito sa Pilipinas or in other country or abroad. Once you have the baccalaureate degree, pwede ka rin mag-continue ng yung pag-aaral and then you can take up a master's degree. So, iba-iba ang ating requirements, no? Depende sa lugar kung nasaan ka. But in the Philippines, okay, depende rin sa school kung saan ka mag-aaral. You need to pass the licensure board examination and of course, sometimes they're asking you to have at least an experience or 1 year experience bago ka makapag proceed to master's degree. And then, the emphasis is on preparing nurses for advanced leadership role in administration, in clinical setting, and in teaching. Yun naman yung focus for the master's degree. And for the doctoral degree, actually, ito na yung kinukuha ng those who have faculty rules in nursing program or those who want to work in the research program. So, mas highest din. So, education, pwede kang magturo. Okay? So, the second criteria is you need to have body of knowledge. Of course, as a profession, and nursing is establishing a well-defined body of knowledge and expertise. Diba? Sa school, pinag-aaralan nyo lahat as theories. Okay? Meron talaga tayong classroom setting kung saan inaaral nyo yung mga concepts before kayo dadalhin sa area to have expertise so that you can apply those concepts or theories you've learned in the classroom. You have to apply it in the clinical setting. So there are nursing conceptual frameworks that contribute to the knowledge base of nursing and give direction to nursing practice, education, and ongoing research. So when we say a conceptual framework, this refers to an analytical tool, no, with several variations and contexts that helps and prepares nurses in providing holistic nursing care. Okay, that through these concepts you can develop standards leading to skills, abilities, and norms. Okay, it must a demand of a body of specialized and systematized training. Service orientation. So for service orientation, it differentiates nursing from an occupation pursued primarily for profit. So many consider altruism, which is the hallmark of the nursing profession. Okay? So when we say altruism, it is a selfless concern for others. So, ito yung pinagkaiba ng ating ng nursing from other profession. The term altruism, well, wherein you have the selfless concern for other people, especially for your patient. Okay, you have the feelings and behavior that show a desire to help other people. Okay, and a lack of selfishness. So, hindi ka makasarili. And ongoing research. Okay? Ongoing research is a process in which decisions are made that result in a detailed plan or proposal for a study, as well as the actual implementation of the plan. So, katulad nga ng na-mention ko before, nursing is an ongoing research kasi iba-iba ang care. Just like na-mention ko before na parang cellphone din yan, 'di ba? Yung cellphone yearly merong bagong specs, nag-upgrade. So it's the same with our nursing profession. So kaya merong research kasi we are upgrading, we are updating the knowledge na magagamit for the nurses. Okay? Kasi iba-iba ang care dahil iba-iba rin ang nagiging illness, ang nagiging disease, just like in our current situation. There is the COVID-19. So ano ang mga nararamdaman ng patient, signs and symptoms of the COVID-19, and how you help your client to prevent, okay, how to care patients suffering COVID-19 virus, diba? Or how to prevent the transmission of that virus. So, kailangan din tayo ng continuous or ongoing research. So, it is a careful study. When we say ongoing research, it's a careful study that is done to find solution, diba? And to report new knowledge about something, especially in medical profession. This can somehow help us in new trends when it comes to patient care, just like I've mentioned a while ago. So, it is an important activity of getting information about a subject. Okay, important about a subject in our current situation about COVID-19. So, we need to gather more information for us to know how to prevent the spread of this kind of virus and how to handle patient if a patient is already affected by the virus. Okay? This is also considered a careful and diligent search of something. Okay? It must have developed a scientific technique, okay, which is the result of the tested experience. The code of ethics, which is your number 5 criteria. So, you need to know the code of ethics. So, nursing has developed its own codes of ethics and in most instances has set up means to monitor the professional behavior of its member. So, dapat meron tayong sariling ethical value. Yan, meron tayong ganon. So, nurses have traditionally placed a high value naman on the worth and dignity of others, diba? So, it requires integrity. Nurses is actually expected to do what is considered right regardless of its cost. So, ethics or ethics code or ethical code change as the needs and values of the society change. So, nababago rin yung codes na yun. Okay? And the purpose of your code of ethics is, of course, to have standards of care, guidelines of how to care for your patient. Should be distinguished from other courses. And, of course, to protect your patient, especially the right of your patient, to protect the right of your patient. So, you must remember that a profession or a professional must satisfy an indispensable social need and must be based upon well-established and socially accepted principles. So, it must requires the exercise of discretion, judgment as to time and manner of the performance of your duty. So, autonomy. So, another criteria, no? Number 6 criteria is your autonomy. So, this means having the authority to make decisions and freedom to act in accordance with one's professional knowledge base. So, once you're a professional, you have the autonomy, okay? You have the right pwedeng pakinggan ang iyong mga decisions. Kasi, syempre, yung mga decisions that you made should be sound and valid, no? Dapat tama ang iyong mga decisions, and you have the freedom to act of course in accordance with the knowledge that you gain or you learn from the school. Okay, so the professional, meron na kayong autonomy and making decisions, especially in the practice. And to be autonomous, a professional group must be granted legal authority to define the scope of its practice. So, ano ba yung scope? Ano ba yung coverage ng iyong practice as a nurse? Okay, it describes particular function and roles of a nurse. So, once you have the license, you can ito na yun. Ano ba yung mga legal authority? Ano ba yung mga scope ng yung practices? So, once you are licensed, pwede ka nang magbigay. You can administer medication to the client. Yan, you can give care to the client. So, kung ano pa yung pwede mong ibigay sa patient. And, for example, once you have the license to insert IV or IV therapy nurse ka na, you can insert IV to the client. So, mga ganon. And you have to determine its goals and responsibilities in delivering of its services. So, ano ba yung mga goals mo? Ano ba yung mga target mo for the patient? Ano ba yung goal mo? Ano yung responsibility mo in delivering your service, implementation as a nurse? And number 7 is professional organization. Okay. So, this means that nursing operates under the umbrella of professional organization. It differentiates a profession from an occupation. So this means that nurses need to work with their professional organization. So ano ba yung mga professional organization that we have in America? They have the ANA or the Association of American Nursing Association. So American Nursing Association or ANA. And in the Philippines, we have the PNA. You have to be a member of PNA. So once isa ka ng professional nurse, you have the license to work as a nurse, you need to be a member of PNA or the Philippines Nurses Association. So, nagbabayad din kami dyan yearly for membership. So, pwede ka rin magbayad ng lifetime membership. So, mas malaki lang siya. So, you need to work under that organization. Kasi, yung organization na yan, that will also protect you. Okay? So, yung governance na term na ginagamit natin. So, ang ibig sabihin ng governance, the establishment and maintenance of social, political, and economic arrangement by which you nurse as a practitioners control your practice, their discipline, their working condition, and their professional affairs. So, it will also protect you as a nurse. Now, let's move on to personal and professional qualities of a nurse. Okay. Personal qualities of a nurse. Meron tayong tinatawag na 6 C's. This includes care, compassion, competence, communication, courage, and commitment. Okay. Care. So, care. So, you are familiar with care. Diba nga, ang nursing is caring. So, nursing is caring or nurturing. Okay? care is the most unique characteristic of a nurse. It is a word of being connected, okay? Connected to your patient. It creates a positive, okay, or possibility, okay? So it involves providing presence, okay, providing presence. So nandun ka with yung presence mo nandun to help your client, to listen to your client, to comfort your client, to know your client, okay, and their family member or relatives, no? And another one, or the second C of personal qualities of a nurse is the compassion. So, ano ba yung compassion? You have to show kindness, okay? Caring and willingness to help others, okay? Yung positive emotion, yung i-attract mo. You have to be thoughtful and decent to your patient. You need to show to your patient that you are ready, okay, that you really want to help your client, to help out with the client, especially on your client's current situation. So the third C is competence, okay? So competence, so may competency kayo, 'di ba? Meron kayong sa nursing, inaaral talaga natin yung competency. So or tinitrain talaga kayo para ma-develop yung inyong competency. What do you mean by competency? Of course, this is the ability to deliver nursing care successfully and efficiently, in which you are able to apply or use the related knowledge, the skills, abilities, or attitudes that you learn from the school or from sa pag-aaral ninyo that is required to successfully perform critical work, especially once you are in the area, critical work or functions or tasks in your work setting later on. And the fourth C is communication. Yan, communication. So, di ba, sabi nga natin, in communication, dapat you learn the art of communication, the therapeutic communication. So, what is communication? How will you define communication? So, it involves two person or more, di ba? So, it is an act of transferring an information from one place, person, or group to another. So, of course, every communication should include or involves one sender, a message, and a recipient. So, listening is very important dito, no? As what we say and do, and essential for, of course, in making decisions, in communicating with your patient, communicating with your other health team member, especially to the doctors, to the doctor of your patient, to the laboratories, and so on and so forth. And next is courage. Of course, you need to have courage to speak up when we have concerns, and to have the personal strength and vision to innovate and to embrace new ways of working. So, you have to be courageous. Okay? Sabi nga nila, courageous people are passionate and purposeful. And the next C is commitment. Okay? So, commitment. You have to be committed to your profession. You have to be committed to your kung ano yung dapat mong gawin or responsibility. You need to take action to make this vision and strategy a reality for all and meet the health, care, and support challenges ahead. So it involves dedicating yourself to do something. You have to be dedicated to what ito yung kailangan mong gawin for the patient. Dapat committed ka kung ano yung nasabi mo sa patient, dapat gawin mo yun. Okay, tapos committed ka doon sa mga tasks na dapat mong ma-accomplish. Okay? And let's move on to, okay, so ito pa rin siya, i-discuss lang natin ulit, okay, para mas maintindihan ninyo. Ito yung 6C. Okay, number 1 nga, yung care na i-mention ko na a while ago. So, the care we deliver helps the individual person and improves the health of the whole community. So, hindi ko na in-depth pa ang discussion kasi I already discussed each of these qualities, no? And compassion. This is how care is given through relationships. What kind of relationship is, of course, nurse-patient relationship that is based on empathy, respect, and of course, dignity. It can also be described as intelligent, kindness, and is central to how people perceive their care. And for competence, okay, competence is the ability to understand an individual's health and social needs. So, ability to understand. So, pinag-usapan na rin natin yung kanina na you have, as a nurse, you need to be efficient, no? You need to be, you need to have the ability to deliver nursing care successfully. So, competence and the expertise, clinical and technical knowledge to deliver effective care and treatments based on research and evidence. So, kaya, di ba, may ongoing research nga tayo. So, yung treatment natin should be based on research and evidence that these are really the effective method in caring for your patient or for the recovery of your patient. And communication, again, is essential to a successful caring relationships and to effective team working. Kasi, diba, you're not only communicating to your patient as well as to the other member of the healthcare team. Communication is the key to a good workplace with benefits for those in care and staff alike. Courage. Courage enables us to do right thing for the people we care for. So, having a strong values and confident in meeting the challenges, that means courage. And commitment. So, again, commitment to our patient and populations is a cornerstone of what we do. So, ano yung commitment mo? May kailangan kang gawin. May kailangan kang, may responsibility ka to your patient na may care, may kailangan ang patient na care na kailangan mong i-provide. You need to do that. You need to be committed to kung ano man yung ano mo sa patient, lalo na pag may na-promise ka sa patient. We need to build on a commitment to improve the care and experience of our patient. Okay, so ito lang yung 6 C's natin here. Okay. So, professional qualities. Okay, professional qualities. Hindi na natin to siguro i-discuss in detail, but you need to have a caring nature. So, alam niyo na yung caring. Be empathetic. You need to understand your patient. Try to put yourself in the shoes of others. You have to be organized. Be adaptable to the situation. Have physical and mental endurance. So, kailangan mo yung physical and mental endurance. Alam nyo naman na yung nursing job is a really difficult job. Diba? Mahirap yan. You have more responsibilities, more things to do, more tasks, overload over ang iyong workload. So, not only physical, but you have to have a mental endurance as well. Be quick thinker. Okay, mabilis dapat mag-isip kung ano yung kailangan, lalo na if the patient is on emergency situation. Ano ba yung dapat mong gawin? And of course, be a hard person. And then, another one here is the philosophy of life. No? So, personal qualities under din dito yung philosophy of life. So, it contributes to personal growth. You need to have your own philosophy of life, diba? Kailangan merong kanyan. You need to have your own philosophy of life kasi sabi nga nila, theories can be learned at school. Okay, natututunan natin yung theories, but then yung philosophy, mahirap siyang ituro. So, it contributes to personal growth that relate to moral values and shapes the aspect of the character. So, kailangan kasi yan para ma-shape ang iyong character. And then, good personality, of course, it consists of deeper traits which come from the heart. Okay. So, sabi ko nga, you have to work. Ang nurse, dapat meron siyang bright minds, caring heart, and a healing hands. So, dapat, yan, you have to work with your heart. Let us now move on to contemporary nursing practices. Actually, yung mga na mentions naman natin ng mga concepts a while ago is actually part of your contemporary nursing practices. Okay, so let's just focus on the definition of nursing during the contemporary nursing practices. So, dito nakilala sina Florence Nightingale, wherein according to Florence Nightingale, nursing is the act of utilizing the environment of the patient to assist him in his recovery. So, she is known for her environmental theory. And then, according to Virginia Henderson, the unique function of a nurse is to assist the individual, sick or well, in the performance of those activities, contributing to health or its recovery, or to peaceful death. Okay, not only up to recovery, but of course to help the patient as well to have a peaceful death. That he would perform unaided if he had the necessary strength, will, or knowledge, and to do this such a way to help him gain independence as rapidly as possible. So, sila yung mga significant person during contemporary nursing. So, may mga iba pa. So, these are the certain themes that are common to many of these definitions. Kasi nursing, napakaraming definitions naman na nag-i-exist. Okay, nursing is caring. Paulit-ulit natin sinasabi nursing is caring. Okay. Nursing is a caring profession. It is practiced with an earnest concern for the act of care and a science of health. So, nursing is caring. Alam natin yan. Diba? From the heart, you care from the heart. Nursing is an art and as a science or science. Okay, as a professional nurse, you need to deliver care artfully with CCR down. You need to deliver care artfully with compassion, caring, and respect for each patient's dignity and personhood. You need to provide an individualized care for your client. Okay, nursing as a science. Nursing practice is based on the body of knowledge. Alam naman natin yan, that is continually changing with new discoveries and innovation. So, when you integrate the art and science of nursing into practice, the quality of care you provide to your patients is at the level of excellence that benefits and their families. Okay? So, mas maganda pag kinumbine mo yung art and science para maganda yung quality of care na nare-receive ng inyong patient. Okay, so kasi nga based on scientific knowledge, tapos may compassion, may care, di ba? Tandaan nyo yung CCR. Okay, you deliver care artfully with compassion, caring, and respect. Compassion, caring, and respect, and should be based on the knowledge that you gain. Okay? Nursing is client-centered. So, hindi siya nurse-centered. So, your focus is your client. The need of your client. The recovery of your client. Okay? Nursing is holistic. So, na-mention na rin natin yan. What do you mean by holistic? You have to care not only the physical aspect, but the whole aspect of the your patient, that includes the mental or psychological aspect, the spiritual aspect, and even the social aspect. of course, and of course your physical aspect. So nursing as adaptive, you have to adapt with the environment you are in. You need to be flexible, okay? You need dapat mabilis kang mag-adjust kung nasaan ka. Nursing is concerned with health promotion, health maintenance, and health restoration. So, ano ibig sabihin nito? Health promotion, health maintenance, and health restoration. Okay? So, isipin nga ulit natin yun. So, when we say health promotion, no, you are, as a nurse, you are concerned with health promotion. So, when you say health promotion, it may involve individual and community activities to enhance a healthy lifestyle, such as improving nutrition and physical fitness, no, that is to prevent or preventing drug and alcohol misuse, restricting smoking, and preventing accidents and injury in home and in the working place. Those are example of promoting or health promotion. While in preventing illness, okay, so wala dyan yung preventing illnesses natin. So, it involves a program that yung goal nila is to maintain or prevent illness. Okay. It involves activities such as immunization, prenatal, infant care, and prevention of sexually transmitted diseases. Those are example of your health prevention. Okay, or health prevention, kanina yung health promotion, health maintenance, of course, kasama na yung mga check-ups, ganyan. So, ma-maintain yan. Restoring of health, of course, here, the patient is already ill. Okay, so, the focus mo here is to help the client recover. Okay, a restoration. So, yung mga activities dito, it involves administration of medications, performing a certain procedures like TSB, bathing your clients, giving oral care, yung mga basic procedures that you will learn in the FNPRLE. Okay, nursing is a helping profession. So, alam naman natin yan. That's very self-explanatory. Helping profession, di ba? Ang focus mo nga is to help those who are in need, to help, especially yung needs na when it comes to health. Okay? So, let's move on to the recipients of nursing. Sino ba ang mga recipients of nursing? Okay, the consumer. Okay, yung consumer, patient, and client. Consumer refers to an individual or a group of people or a community that uses a service of commodity. Those are refers to consumer. And the patient is a person who is waiting for or undergoing medical treatment and care. So those are patient. And client is a person who engaged the advice or services of another who is qualified to provide this service. So, consumer, patient, or client, those are the terms that are being used here. Okay, so scope. Discuss ko na rin to ang bilis ko pala, no? The scope of nursing includes the promoting of health and wellness. Again, yung mga health promotion natin kanina, yung mga example, yung mga promoting of health, di ba? May mga examples na akong binigay sa inyo kanina, yung mga promoting healthy lifestyle, like yung nutrition, diet, fitness, or preventing alcohol and drug misuse, yung mga ganun, preventing injuries, yan. So, under yun ang health promotion. Yung preventing illness naman, examples are yung giving, yung mga programs ng government, like yung immunization, like yung ngayon, di ba, pag dumating na yung COVID-19 vaccine, so giving of immunization, or ang nakikita natin ngayon na binibigay ng government na laging nagpapaalala sa inyong mga cellphone na may message sa inyo na pabakunahan ang mga batang 9 months above, lalo na yung mga 9 months old against tindas, o diba yung polio vaccine, and so on and so forth. Okay, prenatal check-up, those are under your preventing illness. And restoring health, again, is the focus here is your patient who is actually ill. Example is giving medication, administering medication, wala na tuloy sa isip ko, no? Performing a certain procedure like yung ginagawa natin sa skills, yung batting your client, doing TSB, doing hot water bag application, yung mga ganyan-ganyan. Caring for the dying, of course. Caring for the dying, you have to, as a nurse, you have to be with the client to give client a comfortable life, no, up to the last minute of his or her life. You have to make her comfortable, and you have to help also the family members or loved one of that dying patient to cope with the situation or to cope with the death of the client. The roles and function of the nurse. So, we're almost done actually, no? Maraming roles and function ang nurse. So, napakadaming roles pala, no? Hindi lang siya basta nurse. Diba? Sabi nga nila, if you care for one patient only, diba? Parang sinasabi nilang you're a nurse or something. But if you care for more patients, you are actually a hero already, no? Yung mga nurses, hero ka talaga. Kita mo naman, no, ang dami-dami mong function or dami-dami mong roles as a nurse. First, as a caregiver, diba? Pag sinabi natin caregiver, you have to provide full care. Full, hindi yung sinasabi ni Orim, diba? May wholly compensatory, partially compensatory, supportive, educative, o diba? So, as a caregiver, you have to give full care to the client, both physically and psychologically. O, diba? So, depending on the need of your client, according to Oren, pwede mong i-apply yon doon. And then, as a communicator, na-mention na rin natin yung communication a while ago, paulit-ulit. Kanino ka ba nakikipag-communicate? To your patient. When you are communicating with your client, you are assessing your client. You are gathering of data. And the data that you gathered from your client, you need to share that data. Hindi mo i-chismis sa iba, but of course, you need to share that data to the responsible person or the one handling your client. Who are they? Of course, those are the physician, the doctor of your client, or other member of the team na meron silang part doon sa recovery of the patient or sa treatment of your patient, no? As a teacher, you have to help your client in the procedure of treatments. Okay, so as a teacher, habang nandyan si client sa hospital, tuturuan mo na ngayon si client how to properly take her medication. Kung kailan iinom, ilang beses, ano ibig sabihin ng mga term na to na nakalagay PRN, so as necessary, so kailan mong iinumin, pag nakalagay dyan TID, 3 times a day, you need to explain to the client kung ilang oras ang interval dapat, paano niya iinumin, or how to perform basic procedure bago sila pumunta, paano mag-wound care kung may wound si patient, okay, paano mag-exercise para ma-exercise naman ng konti si patient para mapabilis ang kanyang recovery, ano ang mga food na kailangan ni patient, ano ang mga food na bawal ni patient. So, you are a teacher, you are giving health teaching to the client. And as a client advocate, you have to act, Okay, acts to protect your client, to protect the right of your client. You have to help your client to exercise their right and speak up for themselves. Okay, so may gusto silang sabihin, hindi lang naman puro sunod lang sila sa kung anong sasabihin ng doktor, ng nurses sa kanila. So dapat din pakikinggan nyo rin sila kung ano yung saloobin nila. Okay? And as a counselor, you have to provide emotional, intellectual, and psychological support to the client as a counselor. And as a change agent, so you have to act, or it is an act, with assisting your client to make modification in their behavior. Ano yung mga modification na yun? Ikaw yung change agent. Tuturuan mo si patient na ito yung imo-modify niya. Kung ito yung practice niya, lagi siyang nagsisigarilyo or umiinom ng alak. So, kailangan tanggalin na yun. So, you have to act as a change agent to help the client na man-modify yung behavior na yun, na mabawasan na yung pagsisigarate or yung unhealthy yung diet niya. So, tuturuan mo siya kung paano yung mga healthy diets dapat ang kakainin niya. So, you need to help your client. You have to act as a change agent to the client. Lalo na pag may kailangang modification sa kanyang lifestyle. Okay? As a leader. So, another role of a nurse or function of a nurse is as a leader. So, magiging leader din kayo. So, ngayon pa lang, practicein nyo na yung pagiging mabuting group leader. Kasi later on, lahat tayo magiging leader din. Okay. By how? By influencing others to work together to accomplish a specific goal. So, ikaw yung leader ni patient. Susunod siya sa'yo kung ano yung goal ninyo towards recovery. So, yung goal ninyo is ma-modify yung kanyang lifestyle para mapabilis ang kanyang recovery. So, ikaw yung leader ni patient. And not only that, you will become a leader to other member of the healthcare team for the treatment of the client. Okay, as a manager, so another role of a nurse or function is as a manager. Here, you have to manage the nursing care of individual, families, and communities. You have to practice how to delegate nursing activities to ancillary workers and other nurses, and supervise them and evaluate their performance. So, as manager. So, meron pang another one, as case manager. You have to work with multidisciplinary healthcare team to measure the effectiveness of the case management plan and to monitor outcomes. So, case manager. So, may hawak ka na isang pasyente. Yung isang pasyente mo, ang sakit niya is complicated. May diabetes, hypertensive, may sakit sa puso, sa bato, or ano-ano pa. So, as a case manager, ikaw yung may hawak ni patient, you have to work with other healthcare team. So, may physician, may specialist na sa cardiologist, merong other specialist naman doon naman sa urologist, yan, sa kidney, ganyan. You have to work with those other member of the healthcare team for the treatment of your client. So, you are the case manager. So, research consumer. Of course, nurses often use research to improve client care. So, yung mga nakukuha sa research, sa study, ginagamit natin yan. Ina-apply yan, we are the consumer, ina-apply natin yan into our practice para mas magiging effective yung ating care doon sa patient at mapabilis ang recovery ng client. And expanded career roles. This refers to a clinical specialist or nag-nurse ka na, gusto mo pang mag-nurse midwives, kukuha ka ng license midwifery, so dalawang iyong license. Nurse educator, like teachers, katulad namin na nagtuturo. So, yun yung expanded career rules wherein nag-undergo ka pa ng more trainings, more pag-aaral. Okay? So, this actually ends my lecture for this week. And just make sure na you have to answer this assignment or take-home quiz. Okay? Merong 3 questions, and I'll just post another folder wherein you will submit your assignments or your output in that specific folder or under this module na week 2. So I hope you learned something from our discussion today. God bless you all. Mag-aral ng mabuti at mag-ready for your quiz next week. Ang coverage is of course the topic today. Yung topic natin today, those are the coverage of our exam next week. So God bless and see you.